An ambulatory radiology dedicated education unit, also known as a DEU, was designed and implemented at a large Midwestern teaching hospital. The clinical nursing questions are: 1, how does a DEU model influence second-term undergraduate students' perception of interprofessional collaboration? And question 2, does any change in perception differ comparing radiology DEU to a rural DEU? And our presenters today are graduate nursing students Sarah Yoke and Ashley Kell. And I will let those guys go ahead and take over here in just a moment.
So I'm Ashley Kell.
And I'm Sarah Yoke. And we are here today to present our project, Dedicated Education Unit in a Radiology Ambulatory Care Area.
So for this project, we followed the Iowa model of evidence-based practice, which has these 6 kind of big steps. First, we identified a topic, then we formed a team, assemble, appraise, and synthesize the evidence, design and pilot the practice change, integrate and sustain the practice change, and finally, the step that we are in currently, disseminate results. So our overall goal was really to improve undergraduate nursing clinical education by creating and implementing an ambulatory dedicated education unit, or DEU, to be included in the curriculum. To be included in the curriculum of undergraduate nursing students. We had 2 clinical nursing questions, which I'll let you read. They were already stated prior to the start of our presentation here. So we're going to differentiate between the traditional model and a DEU. So a traditional model we like to think of as kind of mother hen and her ducklings, meaning the clinical group, which consists of a clinical faculty and then 8 to 10 students, is assigned 1 day a week of clinical. So for example, every Wednesday, the clinical group is on an inpatient unit from 7 a.m. to 1 p.m., where the students might have maybe 1 or 2 patients, but can be paired with 2 different nurses. As a result of this, nursing staff don't really get to know the students individually, and vice versa. A DEU, on the other hand, utilizes the staff nurse to educate the students as they are the experts in their practice. Staff nurses undergo specific education on interacting with and teaching the undergraduate students. So a trained staff registered nurse is called a clinical nurse teacher or a CNT. A DEU provides the staff additional professional development, and it's often a really good step for staff who are interested in becoming preceptors for new RNs. The clinical faculty from the academic institution supports the staff, but they also evaluate the students. And finally, a DEU provides an extraordinary learning opportunity that allows students to connect nursing theory to practice and may provide better preparation for work in the nursing field.
We selected radiology because healthcare focus is transitioning from inpatient to outpatient settings, but nursing education is still highly focused on inpatient nursing. Radiology is also very pertinent to every patient population, whether that be surgical or medical, inpatient or outpatient, adult or pediatric. Radiology is very active in all of these populations. Prior to the start of our project, the radiology nursing leadership team was seeking professional development opportunities for their staff. Additionally, because radiology specifically has several units within the department, they had ample clinical and recruitment opportunities. Historically, within the institution, students had significant decreased orientation time when hired as a new graduate on their DEU clinical unit. Our next step was to form a team. The nurse administrator, who also acted as our mentor, was very involved in this project. We also included nursing leadership team from radiology, the charge nurses, and other informal leaders on the unit. In addition, we had Dr. Forsyth and Dr. Jones, who worked with previous DEUs within the institution, and Dr. Jane Foote, who specializes in educational connections for the institution. We completed an exhaustive literature review of the 3 areas related to our topic, which is dedicated education unit, interprofessional collaboration, and ambulatory care setting. 15 articles showed that a DEU positively impacts student self-efficacy, satisfaction, and communication skills, while increasing staff satisfaction and teamwork. We also found that a DEU improved patient safety and had no impact on missed nursing cares. 3 articles revealed ambulatory clinical setting students benefited from ambulatory or outpatient clinicals. This setting presented significant opportunities, including a unique skill set and a positive learning environment. Finally, 13 articles exhibited interprofessional collaboration positively impacted students' communication, self-confidence, perception of interprofessional collaboration importance, and multidisciplinary awareness. IPC also positively influenced patient perception of quality of care. Through this review, we identified several gaps in literature, including lack of ambulatory care setting, clinical settings, lack of DEUs in ambulatory care settings, and lower level of evidence related to these subjects.
So the next step of the Iowa model is to design and pilot the practice change. So we incorporated a nursing theory to help guide this project, and we tried to immerse ourselves in the practice and work closely with both the academic institution or academic university and institution to educate staff prior to the students' arrival. We utilized the plan change theory. So this theory was created by Kurt Lewin in 1951. It really focuses on 2 main topics or 2 main concepts, which are driving forces and restraining forces. So the driving forces that we noted for this project included institutional leadership support with staff eager to share their practice, prior DEU areas and success within the institution, and undergraduate faculty who are familiar with the DEU model. The restraining forces that we noted for this project included the radiology unit's lack of experience with nursing students, a gap in the literature, as Sarah just said, regarding undergraduate ambulatory clinical sites, and radiology is a really vast practice that includes multiple clinical areas. And so we noted that could be a potential restraining force or barrier for these students. By identifying these restraining forces, we were able to intervene on them before the undergraduate students began the radiology clinical.
The sample that we selected to participate in our project included 8 second-term nursing students from a Southeast Minnesota public university. These students had previously completed 60 hours of inpatient clinical, and the semester's objectives were clearly delineated by the university. The 8 rural hospital comparison sample participants had identical didactic education and objectives. We selected this site as a comparison because it was also considered a new clinical site, and it was also a DEU. The DEU proceeded, this DEU was in a critical access hospital, and the students participated in clinical experiences on medical and surgical inpatient areas, clinical areas, and in the level 4 trauma emergency department of this rural aging community. Our project consisted of 1 faculty, a clinical faculty coordinator, 8 students, 13 clinical nurse teachers, and it took place on 2 radiology units. Due to the vast practice on radiology, we suggested that the students really focus their clinical education in procedural CT and recovery areas. One of the most important steps that we found in making our project successful was properly preparing the staff for change. We built trust with all the staff members, including the radiologist, CT technologist, ultrasound technologist, and other nursing staff. The ample time that we spent shadowing on this unit allowed us to learn the practice, and it allowed us an opportunity to educate the staff about our project. We also attended leadership meetings, presented to the charge nurses, and helped facilitate the clinical nurse teacher classes. Additionally, we prepared informational flyers and table tents to inform staff prior to the project implementation. Through the literature, we found one consistent need for success was proper preparation before the start of clinicals. In order to properly prepare our CNTs, we facilitated an educational day for them to learn how to interact with students in a radiology-specific scenarios. We also created resource binders to have available on each unit for their references during the clinical semester. In order to properly prepare the students, we provided an informational session on what to expect in radiology. We also created a 6-hour skills day for them to help them practice necessary skills and provided them with a radiology practice binder as a resource. All of these steps were taken to help ensure confidence of both our students and our educators.
So we implemented fall semester of 2019, so last semester. The Radiology DEU allowed the CNT and nursing students to really work together as a team rather than it being a student observation experience. The students were there for typical radiology nursing shifts, which means that they had 10 or 8-hour shifts with varying start times from 6 a.m. until about 10 a.m. There was only 1 or 2 students who were on the unit per shift per day. And the clinical faculty, so Dr. Jones and Sarah and I, were not always present while the students were on the unit. We collected both qualitative and quantitative data. Our qualitative data involved focus group interviews with these 6 questions to each clinical group. So the interviews were recorded, de-identified, and transcribed. Sarah and I listened to the recording separately and verified the transcriptions. And then with the help of Dr. Forsyth, we completed a thematic analysis. So this diagram or flow chart kind of shows the results of our thematic analysis with CNT and DEU kind of being the main overall theme. Then there was 2 really positive themes that came underneath that, and those were interprofessional collaboration and clinical learning environment. And then each of those main themes had 4 sub-themes. So for interprofessional collaboration, students noted an abundance of teamwork and friendliness from the unit staff. The students reported an increase in their confidence, and the CNTs proved to be great role models for these students. For the clinical learning environment, students reported their nursing knowledge increased and that they liked the opportunity to see different areas of nursing. They also recognized that working the nurses shifts allowed them to have a greater understanding of the patient's story from start to finish.
We collected 2 quantitative measurements for our project. The first was the Interdisciplinary Education Perception Scale. This 18-question scale measures interdisciplinary perceptions on a 6-point Likert scale. We administered the survey both pre and post-clinical to both intervention and comparison groups. For each DU location, a paired t-test was used to determine whether the average score increased before and after clinical. To compare the change across the location, an independent 2-sample t-test was used. Statistical significance was tested at the 0.05 level. For both locations, the average score was actually quite high prior to clinical. This left little room for improvement. Indeed, there was very little change in the scores from pre to post. There was also no evidence that these changes differed across the location of the DEUs. The second quantitative measurement utilized was the Clinical Learning Environment, Supervision, and Nurse-Teacher Scale, also known as the CLES+T. This is a 34-question survey that measures teaching atmosphere, clinical learning atmosphere, and supervisory CNT relationship on a 5-point Likert scale. We administered this survey to both clinical groups post-clinical. Comparison across locations using the CLES+T responses were tested with a 2-sample t-test for independent samples. Statistical significance was again tested at the 0.05 level. Again, there was no evidence of change of the concepts measured by CLES plus T. Responses were very similar for the two locations, and none of the responses differed significantly for each other. What all of our results were telling us is that even though the DEU and ambulatory care setting of radiology was very different setting, the interactions the students got were very similar to other DEU locations.
So the next step of the Iowa model, we're kind of in between this step and then the final step, which is dissemination. So this step focuses on integrating and sustaining the practice change. So we've been able to kind of do that by increasing the number of radiology students, as well as training in additional CNTs. We have increased clinical faculty due to the increase in number of students. And the institution is looking to implement this sort of clinical rotation, this radiology DEU in other radiology areas. And our dissemination plans have changed due to COVID-19. However, we were gracious that we were able to present to our graduate class, participate in this Creative Community Achievement Day. We will be, I guess, doing the virtual research on the green next week. We plan to share results with the radiology units and the academic institution who were involved in the pilot semester. And finally, we are working on writing a manuscript with hopes to publish. These are our references. And I think we have just a couple minutes. So are there any questions?